السلام عليكم، أنا بنين هادي من جروب سي. موضوعنا اليوم عن سيف تراك تارنك بريكنانسي. وصلنا للموضوع مع تراك بريسكريبشن تارنك بريكنانسي. كمقدمة بسيطة عن الموضوع، many pregnant women take at least one prescription track during pregnancy, but not all prescription medicine is safe to use during pregnancy. نجي على أهم دواء يأثر على الحمل ويأثر على الأم والجنين بشكل خطر في بعض الأحيان هو الأنستيزيا. All elective surgical procedures should be avoided during pregnancy, but necessary surgical intervention should not be delayed. The best time to procedure this will be second trimester week, because this will not expose an early fetus to drug and it is still too early to provoke premature labor. عندنا general anesthesia. Complication with surgery under general anesthesia during pregnancy تتضمن لنا pulmonary embolism pulmonary edema acute respiratory distress syndrome وكذلك preterm labor. These are risk of untreated oral or maxillofacial infection which bears a greater direct risk to both the fetus and the mother including preterm labor with complication of premature neonates, fetal death, maternal spaces, and septic shock. And general anesthetic may be divided into inhalation anesthetic intravenous anesthetic. نجي على الانهالation anesthetic. The minimum alveolar concentration of volatile agent is a term used to describe the potency of anesthetic vapors. In pregnancy, neural tissue show increased sensitivity to effect of volatile anesthetic. عندنا the high level solubility and low molecular weight of all commonly used volatile anesthetic facilitate rapid transfer across the utero-placenta units. Example of this هو الانفلارين والآيسوفلارين والسيفوفلارانس والتيسوفلارين والهالوثان. نيجي على أول نوع من الانترافينوس انستيزيا هو الثايوبنتوان أو الثايوبنتال صوديوم. is the most extensively studied intravenous anesthetic agent and has been shown to be safe in obstetric patients. And thiopental rapidly crosses the placenta and has been detected in umbilical venous blood within 30 seconds of administration يعني بعد 30 ثانية من وقت الإعطاء. And the fetal maternal transfers is strongly influenced by maternal and fetal body concentration. نيجي على propofol. And the propofol is now the most widely used drug in anesthetic practice and produces a rapid smooth induction of anesthetic. نيجي in pregnancy. Increases maternal blood flow, awareness placenta tissue uptake, and rapid transfers across the placenta. It is highly protein bound, and so placenta transfer is affected by change in the plasma protein concentration and may be increased by reduced protein concentration in the maternal blood. There are concerns over its capacity to produce neonatal depression and to provide adequate depth of maternal anesthesia. نجي على اللوكال anesthetic track. خلصنا من موضوع الجنرال، نجي على اللوكال. Commonly used local anesthetic in obstetric have low molecular weight, high lipid solubility, and low ionization. Local anesthetic crosses the placenta by simple diffusion. These agents إنه هذا يعني هاي أدوية مالت local anesthesia الميكانيكية مالت العمل مالتها شلون إنه work by binding to the receptor sites of sodium canal, blocking ion movement across nerve cell membrane and preventing the initiation and propagation of action potential and subsequent sensory nerve transmission. أمثلة على local anesthetic drugs هي البابيفايكان واللايتوكان والأمينز والإستر. نجي على أول نوع هو البابيفايكان. This drug when administration correctly يعني عندما نعطيه للمرأة الحامل بشكل صحيح via the epidural route in dose 10 to 12 times. The amount used in spinal anesthesia has been used for obstetrical analgesia and anesthesia without evidence of adverse effect on the fetus. نجي على ثاني نوع من اللوكال anesthesia هو اللايتوكان. اللايتوكان is local anesthesia can be found in some over-the-contour pain relieving cream and patches. The lidocaine has also been used to treat ventricular or abnormal heart rhythm. نجي خلصنا من موضوع الانستيزيا، نجي على موضوع الانالجيزك. الانالجيزك هو موضوع شاسع وواسع بصراحة يعني، بس هناخد ملخص عليه. الانالجيزك any drug that relieves pain selectively without blocking contraction of nerve impulses, markedly altering sensory perception or affecting awareness. يتأثر على الوعي مالتنا. There are two main categories of pain relievers أو analgesic. أول شي هنقسمها لجروبين، جروب A وجروب B. جروب A هو non-opioid analgesic include تتضمن 3 أنواع، الباراسيتامول وهو الأكثر شيوعا، والأسبرين والنون-steroidal anti-inflammatory drugs. نجي على جروب B هو الأوبيويد analgesic include المورفين والكوداين والميبريايدين. نجي على جروب A هو الأول نوع B هو الباراسيتامول. It is one of the most widely used and famous medicine. It's a medication used to treat pain and fever. It is typically used for mild to moderate pain relief. The effect مادة lasts between 2 and 4 hours. إذا كانت المرأة حامل، الباراسيتامول is the preferred choice to treat mild or moderate pain or high temperature fever. Paracetamol has been used routinely during all stages of pregnancy to reduce high temperature and pain relief. نجي على ثاني نوع من المسكنات الآن هو الأسبرين. الأسبرين is a medication used to reduce pain, fever or inflammation. For pain or fever effect typically being within 30 minutes يعني الألم والسخونة أو الحمى يكون التأثير ماده يطلع بعد 30 دقيقة. نجي على pregnancy. Low dose of aspirin has been used during pregnancy to prevent or delay the onset of preeclampsia. Daily low dose aspirin has been shown to be associated with low likelihoods of serious maternal or fetal complication. Administration during labor and delivery is not recommended as the onset of labor may be delayed and duration increased with a greater bleeding tendency in mother and child. نجي على الجروب B. الجروب B وهو الأوبويدز. الأوبويدز are substances primarily used for pain relief in including anesthesia. عندها هواي استعمالات، بس احنا أكثر شي نهتم بيه حاليا هو بموضوعنا هو اللوكال anesthesia. possible risk to pregnancy يعني أكثر الخطورة المحتملة تأثر بيها على الحمل هي neonatal opioid withdrawal syndrome والcongenital heart defects والneural tube defects والgastroenteritis الستيل بيرث والبريتيرم دليفري.